These exercises are to improve elbow strengthening.
Go.
This exercise are different variations of bicep curls. Patients should be standing in a comfortable position with their feet approximately shoulder width apart while holding onto weight and dumbbells in both hands. Patient will then perform elbow flexion with hands in a neutral position. These are called hammer curls, alternating between arms for a total of 3 sets of 10 repetitions. To progress this exercise, the patient will then perform the same thing, but the arms will be in a supinated position. These are normal curls, and these isolate the biceps more. The final progression of this exercise, the patient will perform the same motions as earlier, but will be sitting in a chair with their feet in the air, not making contact. This will also isolate the biceps more and improve core strength and stability.
The next exercise will be wrist curls. The patient will begin in a seated position, feet firmly placed on the floor, legs about shoulder width apart. The patient will place his or her forearm on the table with the wrist hanging over the edge. The patient will then perform wrist flexion, wrist extension, radial and ulnar deviation, and pronation and supination of the wrist. They will repeat these motions 3 to 10 times. To progress this exercise, the patient then can add weight to the exercise. Again, performing wrist flexion, extension, radial and ulnar deviation, and pronation and supination. To further progress this exercise, the patient then can increase the weight.
The next exercise we will be performing are tricep dips. The first progression of this exercise is to do the exercise with the knees bent. The patient can perform this for 3 sets of 10. The next progression is to do the same exercise but with the legs extended. Again, 3 sets of 10. The final progression is to elevate the feet onto an object and perform the tricep dip. Again, 3 sets of 10.
Our next exercise are variations of tricep extensions. The first exercise is have the patient stand, or rather bend their knees in a lunge position and holding the weight in a neutral position and kicking back the weight. This tricep extension will work one part of the tricep heads. The next progression is to hit another part of the triceps. The hand will then go into a pronated position while performing the same kickbacks. Do each of these exercises 3 sets of 10. The last progression of this exercise is have the patient stand in an upright position comfortably with their feet shoulder width apart, and then have the patient do an overhead extension. This will work the last tricep head. Performing all these exercises are for strengthening the triceps.